think the major misconceptions, and I guess I can only speak to my personal experience because I don't know that there's necessarily sound data or literature on this concept, but in my own experience, we don't talk about it often enough because we're embarrassed. We want to be seen as competent by our peers, by physicians, by our patients, and we have to be strong, and so we go to work and we don't talk about things. We play the game of, well, this is bad, but it could be worse, and that's true. I mean, there are definitely spectrums of things that are bad and horrible, but just because it could be worse doesn't mean that your current truth is not bad. And so there's a gross misconception that we make people feel better by saying, well, you're going through XYZ situation, but at least you don't have ABC situation. And I personally don't find that comforting, and that honestly discredits how that person is feeling in that moment, and we're not allowing them to feel what they feel. So supporting that kind of concept. And then I guess other misconceptions, particularly to not only pharmacy residents but medical residents in general, is that there is no time or ability within residency training to seek the help that you need. And so, I mean, logistically, therapists and counseling and medical professionals that are trained to help people with mental illness, their offices are open from 8 to 5, which is also when I need to be at work taking care of my patients. So as a pharmacy resident or a medical resident or anyone training to provide care, when do they take the time to care for themselves? And we have traditionally done a very poor job of saying that that is okay to take that time, or that we can adjust rotations or do what we need to do so that you can go to your doctor's appointment so that you can then be a phenomenal doctor. And so that, I think, is a misperception. Maybe not necessarily a misperception, but something we as a system need to do a better job of being open with learners and saying these opportunities exist should you need them or should you seek them.